Welcome to this first press conference for 2022, organized by the National COVID Management Center. My name is Peter Springer. Before we start, I'd like to invite Dr. Fiona Meyer to lead us in a short prayer. Dr. Meyer.
Let us compose ourselves for prayer. Most Heavenly Father, we give you honor and praise as we come before you with a grateful heart this morning. We pray that the proceedings may be pleasing to your sight in both what we say and what we do. In a special way, we pray for our nation, St. Lucia. We pray for peace. We pray for healing. We pray for covering, dear Heavenly Father. We thank you for bringing us safely through the day, and we ask for your continued blessings on all of us present here. Look out for our various children along the way, dear Heavenly Father. Cover our nation, St. Lucia, so that we can have an end to this pandemic as we continue to look to you for guidance, for protection, for healing. Bless these proceedings, dear Lord. In Jesus' name I pray. Amen.
Thank you, Dr. Mann. Good morning once again and welcome. Today's press conference is taking place against the backdrop of a significant increase in daily COVID-19 infections. While a surge in cases after the festive season was anticipated, the steep rise leads us to believe that the Omicron variant is responsible. This is consistent with the increase in infections that are being observed in neighboring countries around the world, especially in Europe and the United States. In Europe, almost 7 million cases were recorded in the first week of 2022. And this past Sunday in the United States, the number of people in hospitals was almost the same as St. Lucia's population. What does this mean for St. Lucia as we try to live with COVID? What are our options for controlling this fifth wave? What are our responsibilities to ourselves, to our families, to each other, and to our country? Many, if not all countries around the world, have decided that while living with COVID is challenging, that at the very least, it is worth the try, because the alternatives are extremely painful for the entire population. It is painful for our children, whose education is disrupted by an ineffective online learning system that leaves too many of them behind. I have no doubt whatsoever that the vast majority, if not all of our children, want to be in a school environment, a physical school environment. Our businessmen and women, our fisher folk, market vendors, they will all prefer to be in business and to stay in business, because that's the only way they can feed themselves, their families, they can pay their workers, and repay their debts to the banks. Our workers would want to stay in work, to cater to their needs and that of their families, to build their homes, and to pay off their mortgages. Our frontline workers, who have been unable to lead normal lives for almost 2 years, will want to take some time to themselves to be with their families. Our sportsmen and women would want to pursue their dreams of international competitive medals. So, in sum, every St. Lucian, whatever his or her gender, job, age, religion, or political persuasion, has a vested interest in ensuring that our country overcomes this fifth wave in the shortest possible time. The question that each and every one of us must ask ourselves is, how do we contribute? How do I contribute? What must I do? The simple reality is that our future and that of our country is in our hands. It means things can get better or get worse depending on our behavior and the choices we make. We can and we must beat this fifth wave quickly. There is simply too much at stake. Through this event, this press conference this morning, we hope to achieve the following objectives. Firstly, we want to give you the basis for public cooperation in helping to overcome this fifth wave of the pandemic. And secondly, we hope to build public confidence in the measures that we are adopting to deal with the peak of this wave. With us today as panelists is our Chief Medical Officer, Dr. Sean Belmar-George, who is accompanied by a team from the Ministry of Health that includes National Epidemiologist, Dr. Michel Francois, National Immunization Manager, Dr. Tekla Jean-Baptiste, and Medical Director at the Respiratory Hospital, Dr. Lucia Eugene Ford. Following a group presentation from the team from the Ministry of Health, we will have presentations by Dr. Fiona Meyer, who will address matters pertaining to schooling with COVID-19. And she would be followed by the President of the Medical and Dental Association and HGS's Person of the Year, Dr. Noel Clark, who will speak to the broader issues and share her association's perspectives on the societal response to the fifth wave. And after these presentations, we will have a 45-minute, or at least a 45-minute question and answer session with you, our members of the media. So welcome once again. And with this, I turn the floor over to Dr. Sean Belmar-George.
Thank you very much, Mr. Springer. Good morning to all. 2022 marks the third year of COVID-19, and we are into our fifth wave. COVID-19 is not new to us. From a public health management standpoint, although we note new and emerging variants of concern, COVID-19 is no longer new to us. Over the last 2 years, we have learned the most effective measures, and we have sufficient data on our local population to recommend targeted approaches to the areas of transmission in an effort to minimize the health, economic, social, educational, and health impact of this virus. We are hoping that those new targeted approaches would allow us to live safely with COVID. From the Ministry of Health team, we'll start off with our national epidemiologist, Dr. Michel Francois-Dauvin, who will give a status update of where we are in relation to the fifth wave. We have our immunization manager, Nurse Tekla Jean-Baptiste, who will give an update of our vaccination status and where we are, and also give an idea of our new plans to increase vaccine coverage into this year. And we also have the medical director of the Respiratory Hospital, Dr. Lucia Eugene Ford, who will indicate the preparation of the Respiratory Hospital to manage the surge that we note with the fifth wave. I will also be giving a summary on the Ministry of Health's preparation of the various aspects of the COVID-19 response to manage effectively the surge in cases that we are seeing. So I would like to, at this point, hand over to our national epidemiologist, Dr. Michel Francois-Dauvin, to start off with a status update of our fifth wave. Thank you.
Thank you, Dr. Belmar. A pleasant good morning to the St. Lucian public, and all the best for 2022. This morning, it's my pleasure to give you a short update on what is happening as it pertains to COVID-19 globally, regionally, and at a local level as well. Can I have my presentation loaded, please? As of January 2nd, 2022, there have been just over 289 million COVID-19 cases reported globally, with just about 5.4 million deaths. As of the last week, the week of December 27th through to January 2nd, 2022, there has been a very steep increase in cases, which represented at least a 71% compared to the previous week. So that is quite significant in terms of the number of cases, and this comes following a very gradual rise. The increase has been noted in all of the WHO regions, and the region of the Americas, however, has seen the largest increase in cases, representing a 100% increase. The highest numbers of cases have been reported in the United States of America, the United Kingdom, France, Spain, and Italy. What they have noticed also is a decrease in deaths. And we noticed that in these countries, Omicron has been the dominant variant. And it has been reported that Omicron is, although more infectious than the previous strains, its level of severity is less. So this is reflected now in the data. Although hospitalizations are up, persons are still going to hospital, persons are still becoming ill. However, we are not seeing the sharp increase in deaths as compared to the number of cases that we are seeing globally. And hopefully this is a good sign. It is very premature, but we continue to monitor the data and see what is happening globally so that we can adjust at our local level and manage COVID-19, this fifth wave, accordingly. Regionally, if you note, this graph reflects just what we saw at a global level. We have over 2.5 million cases confirmed within the Caribbean region, with just about 29,000 deaths, and a very steep increase, and this has been the highest number of cases recorded since the onset of COVID-19. Also at a regional level, but broken down so that persons can see, we note that we look at the number of new cases in the last 7 days, and also taking into account the population, we look at the incidence of these countries as well. And we note St. Lucia in red with a number of cases of 1,297, and this is as of January 10th, and an incidence of 727. And if we look at some of the other member states, we're looking at, for example, Antigua and Barbuda with an incidence of 935. We're looking at Dominica with an incidence of 1,062. Also at Barbados with an incidence of over 1,000 as well. So it is not something that is specific to St. Lucia. The world right now is going through a very, very steep surge in COVID-19, and it's a matter of balancing. Now countries are struggling to balance their responses to COVID-19, and hence the reason we are here calling on the general public. This is a nationwide approach, and we believe that persons need to be armed with the information so that we can work together to keep COVID-19 under control. Now, locally, this is normally our EpiCurve, one of the last slides, but I wanted to put it so that persons remember the first two slides. What we saw globally, what we saw regionally, and what we are seeing locally, the same very steep increase in cases noted. And we have been tracking COVID-19 for a while now, and the number of cases that we saw in this week, the first week in January, has surpassed the numbers that we have seen weekly since the onset of COVID-19 in St. Lucia. In terms of some of the indicators, I will not go into detail with all of them, but it is worth looking at comparing the past 7 days, which is from January 5th through to January 11th, and comparing it to what happened end of December into the beginning of January. We note an infection rate of 116.6 per 100,000 population, and this is compared to the 47 that we were at in the previous 7 days. So we have more than doubled the infection rate. When we look at also our test positivity rate, that has significantly increased as well. So we look at a number of indicators in terms of determining what is happening locally to guide us in our response. No one indicator can tell us that we are heading in the right direction or on the wrong direction, but we look at a core set of indicators that we monitor daily to determine the best approach and how best to deal with COVID-19. These are some of our public health indicators that we also monitor, and we gave for reference where we think we should be, or where we should be in terms of low transmission rate, where we have a proper grasp on COVID-19. This is data as of the 11th of January, and we're looking at the hospitalization rate at the respiratory hospital. we need to be at less than 50%. We are currently at 34%. In terms of the rate of hospitalizations due to COVID-19, we would like to be under 20%, and we are currently at 18%. And these are targets that we have given ourselves to effectively manage patients and do it in a comfortable manner so that we are able to give the proper care, the best care to our patients. When we look at the daily infection rate, it is 116. We should be under 10. So as per CDC guidelines, international guidelines, when you are under 10 per 100,000, it indicates that you have very low transmission in country. We are currently at 116. We are operating at a reproduction rate of 3.3. To ensure that we do not have transmission, the goal is to have it under 1. And the reproduction rate is essentially the number of cases that are generated from a positive case. So for example, when we would have had 200 cases in one day, with a reproduction rate of 3, that means that there are infection to at least 600 other individuals, and we keep multiplying by the 3.3, and we have a fair idea of how this virus is spreading throughout our population. Our test positivity rate also, for a country to be deemed low transmission, should be under 5, and we are currently at 13.7. And we are hoping to have, or we hoped to keep our cases under 100. We are currently at 1,671 active cases in community. In terms of the distribution of the cases, what we have seen is that the 25 to 49-year age group has been constant. We continue to have that largest population. There has been no significant change in the distribution of cases. We monitor our school-age population now that school has opened to ensure that we do not have outbreaks within the schools, and together we work with the Ministry of Education very closely to keep the children safe and ensure that we do not have any major outbreaks or disruptions in the academic year. During the 5th wave, these are the areas or the health districts where we have identified the majority of cases. When we look at the number of cases, which is in orange, we see that Castries is the area most affected. But when we consider the population, we see that Grosile is actually one of the areas that has the highest incidence of cases in St. Lucia, followed by Dennery, Babono, and Castries. And we also seeing cases among our tourists, which we manage at the hotels, and we have a joint relationship with the hotels in terms of management of these cases. In terms of mortality, we have recorded COVID-19 deaths as well as COVID-related deaths. And one of the comorbidities that we have found in the majority of cases is hypertension. It's no surprise there. We have a population with hypertension and diabetes. It's quite prevalent in our population. And so in terms of deaths, what we are seeing is that 57% of them had hypertension, 39% diabetes, and approximately 37% the combination of the two. So we are encouraging persons with underlying illnesses to monitor themselves, to adhere to protocols, and try to limit the risk of exposure as much as possible. So in terms of projections, what we have done is looked at our 4th wave and our 5th wave. And we note, as indicated earlier, that our 5th wave we have a very steep increase. Our 4th wave was very drawn out, a long period of time. We battled our 4th wave. But this steep increase we are seeing is cause for concern, obviously, because what we may have is our healthcare system being overwhelmed. These are the projections that we're looking at in terms of cases. The red line would indicate the upper forecast, the upper level, and the green line would indicate the lower level, persons adhering to protocols and with the necessary adjustments to public health measures. And we note that the numbers, worst case scenario, we're looking at just what we're seeing now, the numbers in the 200s and up on a daily basis. So this is what we are in for unless we make the necessary changes, unless we start adhering more strictly to the protocols, to the public health measures that has been explained to us in the past. And I know there is a level of COVID fatigue right now. However, the Omicron variant is quite transmissible. We have not detected any cases in country. However, based on what we are seeing on the ground, based on what we are seeing in our neighboring islands internationally, we do suspect that it is on island, and we behave as if it is in island at the moment. So I will touch on contact tracing because I know we have a full panel. There are some characteristics of COVID-19 that has made contact tracing and the management of COVID-19 quite difficult. We look at the way it is transmitted in terms of droplets. It can be dispersed over 1 meter. It has a very long incubation period, which makes it very difficult for persons to have that recall where they have been in the past 14 days, who they have spoken to. A lot of us can't even remember what we have eaten in the last 2 days, much less the individuals that we have spoken to. So in terms of getting contacts, that has been a challenge with individuals. Persons may be asymptomatic, have no symptoms at all, but still be able to spread it. And due to that, persons go to work, they go to school, and they mix and mingle with friends who appear normal. And so there is a high risk that persons can get infected because persons do not seem to be infected. But contact tracing is a process, and it needs to evolve with an epidemic. Now, in the early stages of an epidemic, the focus really is containment. And you walked with us during these early stages when we were out there on the ground identifying cases, ensuring that they were linked to certain transmission chains. And that was in the first phase, the first 2 phases. Containment, to stop the disease from spreading to the entire population. At this point in time, we are currently at phase 4, which is where we are seeing large outbreaks with nationwide transmission. And really the aim of contact tracing now needs to move with this phase of the epidemic and focus on areas where we will get the largest effect, where our effect will be felt. So with the opening of school, for example, contact tracing needs to be strengthened in that area to ensure continuity. We're looking at enclosed environments such as the homes and hotels, etc., where the spread or the transmission of COVID-19 is greatest. So in the coming days, you will receive updates from the Ministry of Health as it pertains to contact tracing. We have been having large volumes of cases being diagnosed in country, and that has really stretched resources. Contact tracing is a very intense process. It's very time consuming, having that conversation with individuals, getting the number of contacts, following up each contact. So there have been some lapses in terms of contacting persons, and we ask the public to bear with us as we re-strategize in the face of this drastic increase in the number of cases. And as I indicated, we will be in communication with the public as to how the face of contact tracing will be changing and how best we can adapt to help St. Lucia and help you reduce the spread of COVID-19. Thank you.
Thank you very much, Dr. Francois. And as she has highlighted, we are managing our 5th wave, as most persons have noted. This is the wave with the highest transmission rate, so we do expect large increases. We have not peaked as yet, so we expect to continue getting increasing cases over the next week at least. And we really need the public to ensure that the various public health measures are enforced and implemented at every single service. Dr. Francois also spoke on the importance of contact tracing and how it now needs to evolve. We need a level of personal responsibility from the public in ensuring that all of their contacts are informed and notified, including both work contacts and their social contacts. At this point, I would like to hand over to our immunization manager, Nurse Tekla Jean-Baptiste, who will give us an update on our vaccination status in country and also give us a summary of some of the new measures that we are putting in place for this year to try to increase and improve on our vaccination coverage. Lucia Baptiste.
Thank you, CMO, and good morning to St. Lucia. I just want to take this opportunity to wish each and every one all the best for 2022. As we continue to fight this pandemic, vaccines remain our most cost-effective public health measure in our fight, in addition to the infection control and prevention measures. COVID-19 vaccines, as we know, provides protection against the severe complications of COVID-19 infection, keeping us out of hospital and reducing the likelihood of deaths. The national COVID-19 vaccination rollout started back in February 2021, 10 months ago, and have included a series of strategies, a combination of strategies. COVID-19 vaccines are available and continue to be available and accessible across the island at static sites that are strategically located in the north, south, east, and west of the island. Vaccines are available at all wellness centers. We continue to integrate vaccines into our routine primary care programs, and of course, on the ground, we continue with our home-based vaccination for persons with mobility issues. We also continue to work with the commercial sector, with tourism, and have institutional-based vaccination programs, as well as respond to the call at certain workplaces. That, of course, goes hand in hand with our communications strategy that we have implemented throughout this whole rollout. We continue with our traditional media, our PSAs, our print, etc. We continue to utilize the social media platform to inform the public and to educate persons. And we continue engaging partners, community leaders, our gatekeepers to support us with education and message penetration at the community levels. Our current situation as it is now, as of yesterday, January 11th, 27.7% of the population has been fully vaccinated. This is approximately 56,000 people. 50,000, sorry, a little over 50,000. 3.4% of the population partially vaccinated. To date, we have administered 5,067 booster doses, and that includes AstraZeneca, Pfizer, and also the Janssen vaccines, which was recently introduced into the vaccine program. In terms of our trends, what we have noticed is an overall decrease in the response at the vaccination sites over the past 2 to 3 months. Vaccine hesitancy continues to be a major challenge for the rollout of COVID-19 vaccines in St. Lucia. We see the highest uptake of vaccines in our 25 to 49 years old age group, followed by our elderly population, those persons over 50 years. The lowest uptake remains in the younger population group, which is the 18 to 24-year-old groups, and of course our under 18s, where we recently in August introduced the Pfizer vaccine to them. I will use this opportunity just to provide you with an update as it relates to our data relating to vaccination and hospitalizations and death. Because this area has been an area of much interest. Worldwide, we've noted that COVID-19, of course, infections and the complications is highest in the unvaccinated population. And this is consistent with our data here in St. Lucia. For our hospitalizations, 95% of our hospitalizations are in the unvaccinated group. We have 1.8% persons hospitalized who are partially vaccinated, meaning that they have received only 1 dose of the vaccine in the 2-dose regime, and we have 3% of persons who are fully vaccinated. As we continue to emphasize to St. Lucians, vaccines does not prevent someone from getting the virus, but it protects you from the complications. And if someone becomes infected with COVID-19, what we have noted, if they are fully vaccinated, the symptoms are generally mild, or they are asymptomatic. This data for hospitalization is consistent with that of deaths. We see 92% of our persons who have died with COVID-19 being unvaccinated, 3% partially vaccinated, and 5% fully vaccinated. In the deaths, and I'm sure Dr. Eugene may speak of this, but in persons who have died who are fully vaccinated, the majority of those persons would have had a series of comorbidities, whether it be heart disease, diabetes, hypertension, some sort of comorbidity, some sort of chronic non-communicable disease. So that in itself adds to the likelihood of these persons dying through COVID, because the body in itself is not able to fight the virus, because it's all, as effectively as someone who has a robust immune system, because the system is already immunocompromised. I will just give you a little idea as to what our uptake trends have been throughout the months of implementation. We see very early in the rollout, we had a very high uptake at the sites. And of course, as we moved throughout the months, we noted a significant decline. There have been many factors that contributed to the decline, some of which we know very early in the rollout, when AstraZeneca was the only vaccine that was offered at the sites. Persons at some point had lots of concerns regarding side effects, rare side effects that had been reported, especially on the international scene. Also, persons continue, and at that time, very early in the rollout, lots of persons had concerns about conspiracy theories and side effects and what the components of the vaccine, etc. All of that leading to a bit of hesitancy and persons not being able to make up their minds. Then by the time we had another wave, somewhere around July, August, September, again we noted an increase at the sites. And once the wave, we had the number of cases and deaths had decreased, we noted that significant decline that we are still experiencing now. Generally, what I could say, what we have noted, we see our trends in vaccination sort of matching the waves. When there are high cases and when we see increased cases, we see surges, then the rates of vaccination tends to increase at the sites. And once the number of cases decrease, the uptake is very low. We understand that sort of reaction. However, we just want to continue emphasizing the importance of vaccine. We need to stop. We shouldn't react to number of cases when people are dying and when cases are increasing to vaccinate, but see the bigger picture, the protection that vaccines affords us. Yeah. I will just further go into our vaccine uptake. I just sort of break it up by groups, by age groups. I have indicated in my earlier slide that we see the highest uptake in our 25 to 49-year-olds, and this is really consistent with both doses. We see that sort of a pattern in both doses, but I just want to indicate that our boost, we see a lot of people presenting for booster doses, and that meaning that they have understood the importance of boosting the immune system for that added protection, and we see most of that in the older groups, in the older population. In terms of our districts, we see highest uptake of vaccines in the more densely populated areas. But if we need to go into a more detailed analysis of that, we need to consider population density. Obviously, Castries, Gros-Islet are more densely populated than other communities, so you would see the larger uptake. But we have districts such as Vieux Fort, Labrie that continue to do quite satisfactorily as it relates to the uptake of vaccines, and we continue to encourage that. I will just move in the interest of time. I just want to give you an idea as to what our plans are moving forward in 2022. We continue to strengthen our campaign strategy, have more targeted intervention. What we plan to do is really intensify our community outreach component of the campaign, continue to collaborate with community groups and gatekeepers to deliver targeted intervention, more visibility of the vaccination teams on the grounds and at the community level. We'll continue to expand access of vaccines by engaging more private sector institutions, physicians, etc. And bearing in mind that our lowest uptake is in our younger population of the eligible vaccination group, we are going to have some targeted interventions, engage Ministry of Education, the Ministry of Youth and Sports, so that we are able to target and reach out to our younger population. And of course, our communication strategy, which comes hand in hand, we will continue to strengthen that. At this point, I just want to say thank you and hand over to CMO.
Thank you very much, Lucia Baptiste. As we note with COVID-19, immunization remains one of the most cost-effective and efficient measures in managing infectious diseases. So as we learn to live with COVID, each and every one of us really have to make a bigger effort to ensure our vaccination coverage in country is a lot higher. That way we'll be able to take a lot of measures to allow us to completely open up the country. At this point, I would like to hand over to the Medical Director of the Respiratory Hospital, Dr. Alicia Eugene Ford, who will give us a summary of the preparation of the Respiratory Hospital in anticipation of increased cases in managing this fifth wave. Dr. Eugene.
Thank you, CMO. Good morning to everybody. In order for us at the Victoria Hospital, or the Respiratory Hospital, to prepare for the fifth wave, we had to review what we went through the previous waves. And we're talking about the first wave all up to the fourth wave. And we all knew that the fourth wave shook us. We got a lot of patients coming in during the fourth wave, and it placed us in a position where we had to look at our resources and invent ways in which we can actually do things to save people's lives. So we had some areas that we pulled off. We pulled off these areas because we realized that if we did not tackle or focus on these areas, we would not be able to handle the fifth wave adequately. One of the areas of interest is human resource. The number of healthcare workers available to fight COVID at the Respiratory Hospital was an issue. We had inadequate staff, and as a result, it was difficult for us to take care of our cases how we would like to have taken care of them. However, we have started working by employing some of us more ancillary staff on board. We also have this affiliation or cooperation with the Millennium Heights Medical Complex. So when we want particular skill sets on board, especially skill sets for nurses and physicians, we can have them come across to the Respiratory Hospital when we need them. We continue to work with the Cuban bilateral agreement so we can get some Cuban healthcare workers on board with us to expand our team so we can provide care to the patients that are coming in. We also looked at doing training for the clinical staff, but also we focused on the softer skills because we got a lot of queries, a lot of complaints from the way in which the staff would speak to patients and their family members, and we felt that there's need for softer skills. So we worked along with the public service training division, where we trained our staff on customer service satisfaction, how to deal with difficult persons or customers, and we brought up other topics such as proper deportment, and improving the image of some of our staff members. The other aspect we looked at in preparation for the 5th wave is our maintenance of our facility. During the 4th wave, we had many patients admitted. We had arrived at the point where we had surpassed 130 patients because we had to extend our A&E to have an extra tent out there to accommodate more patients. Now that after the 4th wave and we realized the census had dropped out tremendously, it allowed the maintenance team to go into the wards and to ensure that everything is working properly, meaning electricals, review plumbing, review the beds to ensure that the beds are stable, the beds are working, the doors, the pipes, and everything, so that when we have patients coming in again during the 5th wave, we would have them comfortable and not have them on beds or showers or pipes that are broken. And that was important for us. Very important for us is the medical gas system. Oxygen therapy is a very important leg in treating COVID, and therefore the medical gas system, we pushed to ensure that we have coverage 24 hours a day, 7 days a week. That meant that we had to bring in more porters and roster them so that they can monitor the medical bay, which we have attached to our patients in ICU and HDU, but also be on ground to push tanks to the different wards that are not connected to the system. We also, I must publicly thank Mr. Lucas Lubin, who is the manager of Windward Island Gases, and this gentleman did a tremendous job with us. He is not a healthcare worker, not a nurse, not a doctor. He doesn't work in the lab or the X-ray department, but what I could tell you is this gentleman understood what it was to work alongside the healthcare workers to provide gas, oxygen gas for us, so that we can continue giving the oxygen to the patients that really needed it. And he continues to work with us. So as we move from the 4th into the 5th wave, we keep him abreast, and he's actually giving us updates on how much he has, the supplies, so we'll be able to work with our staff to know how we're going to gauge patients we put on oxygen, and other patients that would probably need oxygen concentrators, we would put them there. So it's been a very good experience working with Windward Island Gases. There are other services we did for our patients and also for the family members, the drop-off services. Family members drop off items at the gate for their loved ones, and we sent out a flyer, and we will resend the flyer because we want the family members to understand why they need to bring in items there and what quantities. We do not want cases of waters and cooked pans of foods and heavy electrical items. I understand that family members miss their loved ones and want to make them very comfortable in the hospital, but when you bring very bulky items, it does create a problem for us. Not only that we have to be bringing up to the wards, but when they are around, so many items around the bed of the patient, it makes it difficult if a patient falls sick or worse or crashes. Then we have to pull up items to be able to attend to them, do CPR, etc. So we are going to recirculate the list out so that persons are aware of what items they need to bring in, so that we don't have so many items on ground, and the hospital, we would not want to be accountable for all these extra items. Additionally, the electricals that are brought in, if there are too many electrical, it will cause a problem for us for our electrical circuits. We don't want our breakers to be tripping, so we really want the public to work with us on that. So our drop-off services will be 6 o'clock, midday, and 5 p.m., and that would allow persons to bring food at these hours. So we have persons assigned to take the food from the gate or the items from the gate and drop it on the ward. If it is dropped at the gate at any hour, it does pose a problem for us because persons have to be leaving the different places of workstation to constantly be at the gate carrying items up and down on the ward. So we want persons to stick to the time of 5 of 6 a.m., noon, and 6 p.m. We will be sending out that information again so that over the media, so that persons are all aware of the drop-off times and the items that we really want persons to be bringing across to the hospital. We brought in patient welfare assistance, and that helped us tremendously, especially for patients that were elderly, differently able, and just to help patients in general. These individuals, they are like patient advocates. They work along with the family members. So a lot of the difficulties that patients would have and may not be able to take care of it immediately, having patient welfare assistance on board would allow them to feed them well, groom, carry blood samples down to the gate, or prescriptions to their family members, messages, or any of the others. So this particular program has worked out tremendously for us, and patients, especially those that are unable to move around and take care of themselves, their family members can say that having these individuals on board have made it an easy experience for them. We have improved radiology services, and our radiology machines continue to work. We have one for wards and one for the A&E department. This was a challenge for us during the last wave, to a large percent of the last wave, but having been able to have a radiology department producing or giving us x-rays in the hospital works out really well for us, as we know that COVID affects the lungs, and a majority of cases that are admitted would have to get x-rays, in certain cases repeat x-rays, and having this x-ray on ground would allow us to diagnose the patient quickly and, of course, give treatment accordingly. Improved telecommunications. We had challenges before, but now with an improved telecommunication, and I'm talking about landlines, cell phones, pins, and even a more robust internet service, we have easier communication between the patient, the family, the physicians. The family members could tell you that they're getting more frequent updates from the physicians regarding their family members, and they can communicate with their family members, although they may not be able to come in because of our restrictions, but having been able to communicate with their family members, it at least allows them to feel a bit more calm about everything that's happening when your family member is ill with COVID. And lastly, we do have a central monitoring system that we have placed up in the high dependency unit, or IC unit. This central monitoring system allows the physicians and the nurses to monitor the vitals of patients who are in the ICU and high dependency unit from their workstation. And that is a 24/7 monitoring system. It works well for us because of the infectious area, and because it's a refurbished building, and our human resource, we don't have all the nurses that we want or all the doctors that we want, but having a central monitoring system allows the team to see the patients at all hours, and if there are any issues or challenges, they could immediately go in and focus on that patient. So we know at Victoria Hospital, we're working very hard, because we know that the fifth wave is there, and we have to try our best to save lives of persons that are coming in. But we want the public of St. Lucia to do their part as well. Help us to help you. Thank you.
Thank you very much, Dr. Eugene, for giving us that update on the respiratory hospital. Our most sensitive public health indicator in the management of COVID is our hospitalization. That is the number of patients that are admitted at the respiratory hospital. As we've been managing the fifth wave, we note that this indicator has not moved significantly, which is very good, and this is what is being seen in the region and internationally, that although we notice a spike, we are not seeing the increase in hospitalization and deaths that would coincide with the increase that we are seeing. And this is very suggestive of the Omicron variant. So we are pleased that we are not seeing the increase that we saw with the fourth wave. But at the same time, we have to ensure that we keep the numbers down so that we don't affect the rest of the services. I will very briefly, because of time, give an idea of some of the preparations under the other response levels of COVID. I'll be very brief because of time as well. In relation to community care, our 5 respiratory clinics remain open to provide care to the public. That is the Grosley Polyclinic, the Dennery Hospital, the Leclerc Wellness Center, the Soufre Hospital, the Vieux-Fort Wellness Centers. We noted the increase at those clinics, and as a result, on weekends, we've opened the Leclerc Wellness Center the full day as well to support the increases that we are seeing at the Gros-Islet Polyclinic. In relation to PCR testing, which remains our gold standard at the Echelon Lab at the OKEU, our present capacity on island is 30,000 tests, and we have the capacity to do about 2,000 tests in any one day. I think the highest that we have gotten is at least 800. We've not reached that capacity. However, we note as we manage the increased cases, we have delays in reporting because we have an increased number of persons to call or to give their results, and we also note the long lines for testing at those centers. So we have since increased and also provide testing at the VG multipurpose center, where we're also doing vaccination, but it's in a separate section. So we're also doing testing there, but for persons who are contacts of cases and not persons who need medical care. We are also working on some other modalities which we will be sharing soon with the public to facilitate easier testing to the public. For contact tracing, Dr. Francois has already presented, so I will not touch on it, but just to say we need the support of the public in contacting their contacts to ensure that they are isolated, quarantine, or that they get testing. We will be providing more information in the week of the new modalities to support our contact tracing efforts. Our government quarantine remains one facility with 140 bed capacity, so home quarantine and isolation remains the modality that we are using, and we appeal to the public for adherence. We know the risks related to this. We need compliance of the public to reduce the spread of COVID by ensuring that you remain in quarantine and isolation. For home monitoring and home quarantine, we have increased the capacity of the team and also increased their equipment to be able to measure, but as the cases increase, this is an ongoing process to ensure that those who need care. Most of our cases thus far for this fifth wave are mild and asymptomatic, which has made it a lot easier on the team. For the respiratory hospital, Dr. Eugene has already indicated the response. In relation to central procurement and our supplies, at all times we maintain a 3-month supply of personal protective equipment, which we have, and we are to receive extra stock, especially for our PCR swabs. Last week we received 10,000 more, and we're supposed to get an added 10,000 by the end of January to ensure that we don't run out of testing supplies. One of the issues that we were managing with the 4th wave, there's been a global shortage of medication, and we continue to note delays in receiving medical equipment and medication into country, and also increased costs of those given the COVID-19 situation. Our ICU drugs were running low at the end of November into December, but we have since received and restocked in preparation for increasing cases as we move into the 5th wave. For immunization, which has already been presented, but I will just add in that the electronic vaccine passport is available for persons to apply, and that we are already working with our regional public health agencies to receive vaccinations for the 5 to 11-year-old group. We will provide more information when we have the actual dates and rolling out of this program. In relation to health education and communication, we have also increased those modalities to ensure that accurate information goes out. Our press releases continue to go out on a daily basis, informing the public of where we are in relation to the outbreak. So at this point, I would like to just thank the public health team of the ministry, and I just want to recognize a lot of the workers who have been going from the first wave up to now. The effort has really been remarkable from the public health team, and it's everybody, both those that are visible and a lot of those who work behind the scenes. So thank you.
Thank you so very much, CMO, and your team for what I considered to be a reassuring, a presentation of reassurance in many respects. There are many things that we have gotten right. There's some things that we need to get right. And we want to assure the public that we're working on these as diligently as we can. One of our panelists, Dr. Clark, has a clinic that she has to get to very shortly. So with Dr. Maher's permission, I will go to Dr. Clark to speak to us.
Thank you, Mr. Chair. Good morning, St. Lucia. I really won't belabor the point that really our excellent team of panelists, they have said everything. When Mr. Chair called, I did say that I had a clinic this morning, my Wednesday clinic, but we understand the importance of being here. We understand the importance, as Dr. Belma said, from the very beginning, of those who've been there, those who are visible and those who are not visible, that when we called on, when your country calls you, that you come. To say a huge thank you to the panelists. You all really have worked very hard under immense pressure. And on behalf of St. Lucia, we say thank you to you. St. Lucians, we see you here as the president of the Medical and Dental Association. And we are in this fifth wave, which was predicted, and it has come to pass. I'm an internal optimist, and I do believe that we can get ahead of this, but we all have to do our part. Most of us are doing our part, adhering to the public health measures which have been reiterated here, and some of us have gotten vaccinated. We urge you, most of us, everybody who is eligible to get vaccinated, to do so, to continue to adhere to the public health measures. Dr. Eugene mentioned the changes that have occurred at the Respiratory Hospital. We want to reiterate that COVID-19 is a very isolating disease. Apart from the fact, the physical toll that it could take on someone, and again, I'm a kidney specialist, so I speak a lot of kidneys, the implications that this has had for dialysis, which is very expensive therapy, has been significant. And based on information from Dr. Eugene, there are plans afoot to increase our capacity to dialyze because it is absolutely necessary. The sheer number of patients that we're having who are requiring this service, our chronic patients who perhaps become COVID-19 positive, or patients who are developing kidney disease because of COVID-19, we have to provide the service to many St. Lucians. And that is important to note. Because something we've noted on the ground is many individuals who say, as Dr. Belma said, we think we have Omicron here. Obviously, it has not been confirmed through gene sequencing, but I mean, the data, the epidemiology indicates that we do. And there is the sense among quite a few people that, well, Omicron is mild, or so it has been said. So why not just get Omicron and get this over with? This is a dangerous way of thinking because COVID-19, again, is a numbers game. So if you have a very large number of people becoming infected, we're going to inevitably have a large number of people requiring hospitalization. Thankfully, we're not seeing that yet, particularly at the Respiratory Hospital. The toll on our members, and again, as Dr. Eugene indicated earlier, it was significant, particularly the health, the mental health impact of the fourth wave on our members. We cannot get away from the fact that some of the healthcare workers, physicians, nurses, the ancillary staff are going to become sick. And in this wave, we are seeing it as well. We have seen some of our members become infected. The reality is, if physicians become infected, they can't work. So they're out for a period of time, and that compromises other services, and that needs to be taken into account. So COVID-19 really affects all of us. It is not just the person that gets COVID, it's the family of that person. And most of us, most of you are doing your part, adhering to the measures, adhering to the protocols, and we'd like to continue to encourage you to do that. The few, and another complaint you hear, of course, is, well, I've done everything right and I still got COVID. So what is the point? But the reality is the more people who are infected, the more people who are doing their part who are also going to potentially become infected. But we'd like to urge you to continue to make the sacrifice, that we all have to continue to make the sacrifice so we eventually get out of this pandemic. We can only do this together. And this is more an emotional appeal more than a scientific appeal, really, because the rest of our panelists really have done that part. But on behalf of our members and on behalf of our country, St. Lucia, we just ask you to, again, help us, as Dr. Eugene said, to help you, essentially.
Thank you so very much, Dr. Clark. Thank you for your sacrifice. On behalf of all of us, I want to ask your patience, we're waiting patiently for you, that you will be there very shortly. Bon, nous savons qu'il y a un monde qui a vu le programme, qui a écouté le programme. Peut-être vous préférez nous parler en créole. Ça nous fait, nous mettons un programme spécialement pour les gens qui préfèrent nous parler en créole. Nous allons faire ça tout de suite, so just need a petite patience et puis nous, s'il vous plaît. So, thank you, medical team. We now go to Dr. Viola Meyer. The issue of the reopening of schools has been a hot topic on media. And we thought because of that, and because of the concerns that parents have about their children's safety in the school place, that we should have Dr. Meyer with us this morning. So Dr. Meyer, I'd like to turn it over to you, please.
Thank you, Chair. Good morning to everyone. Permit me to join in wishing you all the best for 2022, praying for health, praying for safety, praying for peace. As a team from education, we are all convinced of the significance of having our children at school. Luckily, we were able to get confirmation by the Department of Health to move forward with the reopening, and as I said earlier, for the continuation of the academic year, as we had the first term already. We appreciate the concerns, and for us, it is not only about education, it's a national issue. So we do not want a situation whereby education is taken out as a single sector, but that, as the Department of Health has continued to say to us, we must manage in this situation of having COVID all around us. And the schools are no different. So it is to say that we will be managing cases, there will be teachers who are impacted, there will be ancillary staff, there will be children, because we are part of the broader society. But what is really reassuring for us is the support that we have, constant, consistent, always available support from the Department of Health to manage those cases effectively. We continue to speak to the benefits of having our children at school, and always the mental well-being, the psychosocial, the emotional, the nutritional value, coupled with them being afforded an education. Our children have suffered, in my opinion, the last 3 years. Many of them have had significant disruptions and interruptions, but as we chart the way forward, we appeal to our parents, we appeal to our wider community. We note where the cases are, the age range where the cases are. And so these are our parents, these are our teachers, these are our principals, our administrators, our ancillary staff, these are the chief education officers. And so as adults, we have the greatest responsibility to protect our children, to provide a safe learning environment for them. And so we encourage you, as the Department of Health has already done so, to cooperate with us at the schools, to follow the various protocols established at the schools. Dear parents, in terms of dropping off items for your children, in terms of sanitizing, in terms of making appointments prior to coming to the school, all of those various things, we know you've worked very well with us, and we just want to encourage you to continue to do so. The issue of extracurricular activities, socializing after school, constantly comes up, loitering within particularly the city of Castries. There's also a huge parental role that we cannot let you get away from fulfilling, dear parents, And I've said over and over, if my mother said to be home at 4 o'clock, I would be home at 4 o'clock. So parents work with us. Earlier this week, I had a meeting with the mayor of Castries, with the help of the Castries City Council and the City Police. We are ensuring that our children move along in terms of getting home safely, but it is really a great responsibility. We continue to do our sanitization at schools, our surfaces, our school environments, and it is a constant for us in terms of resources put into that system. Dear parents, community members, in the event there are any respiratory issues, illness within the family, prior to COVID, after COVID, it is that we encourage you to keep your child at home. There will be other situations of health, of issues of health, that we must continue to use that very same protocol. In as much as we speak about it during the COVID period, we had spoken about it before. If a child is sick, keep that child at home. If we know the family has been impacted, kindly keep that child at home, but also inform the school so that we are aware of the child's attendance and then we can behave appropriately. We have our secondary school students who are at the age where they can get the vaccines with parental permission. Should that be the case for families, even within our school systems, we're working with the Department of Health to continue vaccinating and to get the vaccination rates up. So there are various schools where parents have given permission to have the vaccines done. We will facilitate vaccinations at the school levels with parental permission through the Office of the Chief Education Officer, the Department of Education, as appropriate. And again, I'm saying, you know, it is a parental choice. And we encourage it, but there is no obligation to do it. But we appreciate that the health professionals have told us over and over, this is one of the best ways to support our children's education. As I end, I cannot end without thanking entire teams on the ground that have welcomed our children back, that have seen the importance of them being at school, that have contributed to their safe return and will continue to contribute to their safe return. We would have originally had a start date of the 4th of January. We have prepared more intensely for the 10th of January return, and by all accounts on the ground, we are doing well. We must continue to look at our limitations, where our challenges lie, and work towards improving upon the situation at hand for our children, the environment where they're at, their well-being, you know, the health and safety protocols, adherence, strict adherence to them. And so an appeal goes out to all of our students to continue to follow those protocols as they go out to the general public, as they continue to do their best, knowing that children are people too, teachers are people too. We have our special responsibility. We have our various roles that we must continue to roll out, but together we can do this. And so we have done it in the past, and I'm hopefully looking forward to a consistent second term for our children. Thank you, Chair.
Thank you very much, Dr. Mayor. And I promised our colleagues from the press 45 minutes at least. And I'm glad that with the cooperation of our panelists, we've been able to keep to that promise. So now I want to turn the proceedings over to our press colleagues to pose their questions, make their comments. So it's over now to you. Can we have our first question, please?
Questions. I'm trying to figure out how to raise my hand and I cannot.
We can hear you though. You can go ahead if you can identify yourself and you can pose your question, please.
Thank you, Mr. Springer. Janika Simon here from the Virgin Islands Consortium. I'm actually asking this question on behalf of my colleague Kiba Taliam of MBC. Let me just grab her question.
Are you still there?
Hi, can you hear me?
Yes, we can. Go ahead, please. We can hear you. Go ahead, please. Yes, Simon. Okay, while we wait to get the technical glitches sorted out, I wanted to ask you, Dr. Ford, in terms of the number of patients that you've treated at Victoria Hospital since the start of the pandemic, could you give us some ballpark figures as to how many people you've treated since the pandemic started?
We're talking about from the beginning of the first wave.
Yes.
It might be difficult to give you a full clear figure right now, seeing that when we started, we were between two hospitals,
Right.
OKUH and VH.
So can you give us for the fourth wave?
For the fourth wave, we're looking at, from then into now, we're looking at about 2,000 patients we have been treating. For the fourth wave, we had above 8, for the fourth wave, which spanned from July into September, we had gone above 800 and something patients. Out of the 800 and something patients we had, 80% of these patients were discharged. 80% of these patients were discharged, and a little above 11% of these patients were actually deaths due to COVID or COVID-related deaths, meaning that the rest were not really COVID-related deaths, were deaths due to other reasons. So a large part of our patients that were admitted during the fourth wave, which is a heavy wave for us, were discharged.
Right, thank you. Are we still, Ms. Simon, are you still with us?
I just put my questions in the chat, but can you hear me now?
Yes, I can. We could always hear you. Go ahead, please.
Okay, thank you so much. So this question is from Kiba Talium of MBC. The admission of people for dine-in service at restaurants requires proof of vaccination. However, we are aware that several businesses, including those along the Rodney Bay Strip, actually are not requesting this information from patrons and still seating them for service. And the question is, what is the Ministry of Health or enforcement agencies doing to address this issue, given that it has also been brought to their attention by law enforcement officers, but such actions continue? And I think, especially in light of the suspected presence of Omicron, which is highly transmissible, I'm sure we can all agree that this kind of circumstance, people dining in a restaurant, obviously unmasked, without presenting proof of vaccination status, needs to be addressed. And my own corollary to that question is perhaps to get some clarity from the medical professionals on the panel. We keep hearing from the public that both vaccinated and unvaccinated people can transmit the virus and contract the virus and transmit it, which is true. Can a medical professional please give us some clarity on the relative rates of contraction and transmission of the virus between vaccinated and unvaccinated people? Thank you so much.
Thank you, Ms. Simon. Ms. Simon, go to you, the CMO for them.
I will allow the immunization manager to respond, or Dr. Francois, on what we are seeing in the rates. But I can respond probably to the restaurant issue.
That's what we'll do. If we can take your questions in groups of 3, I think that will be proper management, better management of time. So are there any other questions from the media pool? Okay, well, we get that sorted out. So, Dr. Francois?
In terms of vaccinated and unvaccinated, what the science has taught us is that you are very correct that both vaccinated persons and unvaccinated persons may acquire COVID-19. However, in terms of the vaccinated individual, the period, the viral load in these individuals is significantly less compared to the unvaccinated, as well as the length of time that that person has that high viral load. And the viral load is quite important because it is the amount of virus that an individual has in secretions. So, for example, in the case of the fully vaccinated, my viral load would be lower than an unvaccinated person. And the length of time that my viral load remains high is significantly less. Hence the reason why individuals are less likely to transmit, or the rate of transmission is significantly less for a fully vaccinated individual. The exact figures we do not have in terms of the transmission rates, but it varies from individual to individual. It varies based on not only the fact that I am fully vaccinated, but whether or not I have underlying medical illnesses as well that would weaken my immune response. So there are several factors that we have to consider in terms of that. But overall, what science has found is that the viral load as well as the period of infectivity is significantly less for a fully vaccinated person compared to an unvaccinated person.
Thank you, Dr. Ponson.
I will just add that we've been getting requests for an indication when we put out our daily update to make it clear to the public from the new cases what percentage are vaccinated and what percentage are unvaccinated. I just want to indicate why we don't do it. We get large numbers of new cases on a daily basis. Our target is to put that information out within 24 hours. Now, we would not rely on somebody just saying if they're vaccinated or not. We have a process of verification, which is time consuming. So we don't have enough time to be able to verify all of the tested persons, positive and negative, to be able to give with a level of accuracy what the percentage is from the vaccinated and unvaccinated. However, our immunization manager, when she does her weekly updates on a Tuesday, she usually provides information on this. So we will do it on a weekly basis. The timing would not allow us to do it on a daily basis. I just want to respond to the other question in relation to enforcement. As I indicated earlier, we are into the third wave of managing COVID. And one of the things which we have discussed on COVID Management Center is utilizing more targeted approaches and strategies in the recommendations that we give. We have enough local data to guide on where the issues are. That being said, our biggest gap, one of our biggest issues in effectively managing and bringing a wave under control has been implementation, compliance of the recommended measures, and enforcement of those measures. This remains our biggest gap in successfully bringing cases under control. So the compliance of that measure at the level of the restaurants is not new. It's added to a lot of the other protocols that we recommend for the service industries that do not fully comply to those recommendations. And you would understand that between our environmental health department and also the Royal St. Lucia Police Force, it is exhaustive the number of services that have to comply to various protocols that are put forward. When you go in, they may do it for the night that an officer is there, but we do not have capacity to fully man every single restaurant. And Rodney Bay is just one example. We have restaurants island-wide. So it has been brought to our attention. We have gone to those restaurants and note that we're not asked. Nobody else is asked. So we have an idea of some of those who don't comply. It remains the biggest gap in the management of COVID on island. And this is one of the things that we are looking at in the more targeted strategies where we don't affect an entire service, but we get an effective mechanism of dealing with the service, the particular establishment that is leading to transmission and causing problems for the country moving on. So it is one of the gaps that we are aware of, and it is part of the strategy that we are working on to see how we fine-tune. It will definitely reduce some of the open measures that affects every service that we have been doing. Thank you.
Thank you very much. CMO, any questions from the media pool? Can we have the next question, please?
Thank you so much. I wanted to find out about
Who is this? Or could you identify yourself, please?
the
Is that you again, Ms. Simon?
I'm sorry. Yes, Janika Simon here.
Okay.
I had more questions.
Okay, go ahead, please.
Thank you. I wanted to ask about the monitoring of COVID-19 and whether the management committee or whether there's any kind of policy discussion going on right now about using new testing methods to help ease testing centers, etc. And that would be the lateral flow home testing kits that have been deployed with relative success in other jurisdictions. What is the discussion about that? And is there any thought to bringing some of those in for at-home testing so that people can, take better control over, possible exposure, et cetera, et cetera?
Okay, do you have other questions?
Yes, my other question is about resources, specifically human resources. Dr. Eugene mentioned, and as well as the CMO, Dr. Belmont George, mentioned the lack of resources, to both adequately or fully cover or monitor enforcement, as well as to cover the respiratory hospital and to do everything that's necessary there. There has been a lot of reporting in the international press that is suggesting that a reliance on personal responsibility, individual personal responsibility, is not enough to get countries and collectively the world out of this pandemic, and placing over-reliance on personal responsibility is leaving us vulnerable to wave after wave after wave of infection with variants coming in, etc. We have seen, it's almost 12 months since the vaccine was introduced, and vaccine uptake is still below 30%. So given the lack of resources and seemingly the lack of adequate personal responsibility, where does that leave the country in terms of managing the pandemic with minimal loss of life, illness, etc.? Thank you. That's all for me for today.
Thank you very much, Ms. Simon.
Okay. In relation to testing, we are reviewing our testing policy. We have been relying on established labs for testing because accuracy of results and also for reporting. We are reviewing our testing policy moving forward, and information will be provided soon to the public.
Thank you. The issue about personal responsibility not being enough, I forgot to ask Ms. Simon whether she had, what suggestions she had to deal with this issue, because the expectation always is that the answers can come from someone else. So we wanted to put you on the spot, if you're still there, if you can share with us your suggestions on this. If I can see on that issue is, yes, it is not enough, but basically the reason why we have wave after wave after wave is because people are not assuming personal responsibility. And I don't know that there's a technique that can force people, or strategy that can force people to accept personal responsibility. After all, your life is yours, and the responsibility to take care of yourself and your families is yours primarily. The state comes in and helps out. So every time we see, as we've seen in the case of the restaurants, where the restaurants don't do their job, and compliance and enforcement has to go in to force that to happen, that tells us that the restaurant is at fault. And the restaurant, as CMO was saying, that particular business has to be held responsible. And I suppose that's the question she's asking. How do we make that place pay the penalty for transgression of the protocols? And that is something that we speak about every day in our meetings. The responsibility really is, as CMO pointed out, is a shared responsibility, but the capacity is very low in across the board. So we'll have to give that some more thought. We've spoken about the police as being the front line on that, but some more has to be done, and we will look at it very carefully. Any other questions from the media pool?
Through you, Chair,
Yes.
I wanted to add, she has a very valid question.
Absolutely.
And human resource deficit is something that is not only unique to St. Lucia, but unique to every single country on the earth. Especially now during COVID, everybody, whether the developed country or the developing country, they would tell you that they have huge challenges with human resource. What we've done at the Victoria Hospital, and we do have human resource challenges, and though I did mention that we've made strides to improve it so that at least during the 5th wave, we would have less of this challenge. But what we've been doing, especially in the 4th wave, that persons have, we've looked at the job description and we've realized that some persons need to do more. We would not ask a domestic assistant to give an injection, but there's nothing wrong, for instance, for a physician to come down and do more. So instead of just sticking to your job description, we've realized, because of the deficit on ground, that persons and everybody, and I'm not only talking about persons that are directly taking care of patients, everyone, including myself, we had to do more. We had to do more, and I think if persons look at what we have existing on earth, what's existing in the hospital on island, and you realize you have to do the extra to save a life, then you go beyond your job description. Looking, of course, within the legal framework, so you don't want to be doing something you're not allowed to do, or you find yourself in problems doing. But the 4th wave has taught us at the hospital, you cannot stick to your job description. Just because you, for instance, a physician or a specialist, you may have to do something else that you probably never thought you'd be doing before, to let the hospital run and to provide care to patients. So that is one of the things we're actually looking at, and we continue encouraging our staff to do it, because we don't have enough human resource. We may get more, but it may never be enough. So we need to do the extra and put the extra hours in to save our people.
And just to add to what Dr. Eugene says, we all have to do more. And I think for the most part, we all have been doing more. And that is the reason we've been able to get over 80% of our patients home. With regard to personal responsibility, it is important. It's a huge part of getting out of this, and it has to start with us. And that is why, as a Medical and Dental Association, we have insisted that starting with us, starting with healthcare workers, everybody should be vaccinated. So those of us who deal with the vulnerable population, so people coming into hospital who already are at their most vulnerable, those of us taking care of them should have a certain degree of protection, and in that we're protecting them. So we as a Medical and Dental Association have really been, our stance on that is unequivocal, and we will continue to advocate for that ourselves, the other essential services. So that to a certain extent, just getting vaccinated speaks to a measure of taking responsibility for yourself, and we do believe that is important. Now, among our physicians, we are mostly vaccinated, but we know the same is not the case for a lot of our other essential workers. So again, when we speak, it sounds, we romanticize, we need to do more educating, and we need to go out in the communities. But when you don't even have your healthcare workers fully vaccinated, do I really need to teach a healthcare worker the importance of vaccination? Those are the questions that we have to start asking ourselves at this point in the pandemic.
Okay. Back to you, media pool. Any questions from you, please?
Yes, good morning, Mr. Springer.
Morning.
Monica McCoy, Choice News Now. Good morning to the panelists. So we want to know, in light of the increase in cases, the business community has been severely impacted, and we have workers testing positive, but we also have reports of inconsistencies in how businesses deal with their positive cases of employees. So is there any available policy document that provides a general guideline on what businesses must do if an employee tests positive, or has there been any consideration given to creating that type of document in light of what we're experiencing? Thank you.
Do you have any other questions? Ms. McCoy? Okay, Simon?
I will allow Dr. Francois to explain on what has already been done and where we are with it. Thank you.
Yeah. So thank you very much for that question. I'm very happy that it did come up. When we noted very early in the pandemic that business places were doing different, having different arrangements in terms of their positive employees, we sat at the Ministry of Health and we provided them with a document, step by step, of what to do if an individual falls ill at the establishment, what to do if an individual tests positive at the institution, also what a contact is. So it's a detailed document that would guide you step by step. In addition, what would happen is the individual who falls ill would get a call from a contact tracer and would inform the workplace of what needs to be done. We also met with businesses, we met with the business sector, to go through this document and to have it widely circulated. Currently, what we are doing at the Ministry of Health is revising our protocols in terms of isolation and quarantine. We recognize globally that there is a strain on human resources. We have been operating at 14 days quarantine, and based on exposure, we determine who is a contact and who is not a contact and how best to proceed. And believe you me, the document contains all of this. But we are in the process of reviewing these timelines, and so a new document will be circulated. But in the meantime, we are still asking employers to ensure that they adhere to the guidelines. These are our current guidelines in terms of the management of confirmed cases, of suspect cases in the workplace, and it has been circulated. If needs be, we can recirculate while we continue to amend the document in keeping with what is happening globally, and to help us balance the health of St. Lucia as well as the human resource needs of businesses, the business place, the workplaces, because we do foresee that many persons will become infected, and we do foresee the strain on the establishments. Thank you.
Dr. Pool. Any questions,
Yes, thank you very much for that response, a great response. Another question from us again, Unika McCoy, Choice News Now. We've seen the advisory from the CDC where they've gone the route of shortening isolation and quarantine periods. Just want to know from maybe a tourism standpoint, is that something that we are considering here in St. Lucia, especially as it relates to maybe visitors coming in or nationals coming in? Have we considered those requirements of shortening isolation and quarantine periods to maybe about 5 days? Thank you very much.
Do you have any other questions, Ms. McCoy?
Yes, Mr. Springer, we do have another question as it relates to the digital vaccine certificate. So this was launched on December 20th. Of course, what we're seeing is from experience, locations are requiring only vaccinated patrons, as we would have mentioned, for either proof of vaccine. What we also want to know, is there any verification being done by DigiGov when it comes to the digital vaccine certificate, and what will be put in place to encourage or mandate businesses to validate the digital certificates? Because we are hearing of reports where it's not being mandated and validated by various institutions. So is there anything being considered or put in place to really enforce this? Thank you.
Thank you.
Okay, so I will continue since I have started on the isolation and quarantine periods. We have reviewed the CDC guidelines, the updated guidelines for the release of individuals at day 5 and shortening of the isolation period. What we have noted in the document as well is that post the 5 days, they are also asking persons to continue wearing a mask to reduce transmission. So that clearly indicates, and we know from the science, that after 5 days, most people are still shedding the virus. Also, within the document, it lists a certain number of activities that people should not engage in, such as flying unless necessary, unless it's an actual emergency. So the document itself was the CDC's means of dealing with the HR shortage that they are currently facing. So it wasn't entirely a public health decision, but it was their means of trying to balance what they're seeing in country, the severe deficits within the hospitals, within the workplaces, and trying to get persons back to work in the safest possible manner. We also note that it does not call for any testing post the 5 days, indicating that there is a very likelihood that persons are still infectious, hence the reason that they have all these caveats listed in the document. So we have reviewed it, and as I indicated, we are currently reviewing our local guidelines in terms of quarantine and isolation, and I'm trying to come up, like they did, with the best fit to balance our workforce as well as public health, because public health is not something that we are willing to compromise at the Ministry of Health. And until we feel it's safe and we have come up with a proper alternative, our current guidelines stand, and we will continue reviewing, and shortly we will update the public as to what decision has been made in the best keeping of public health in St. Lucia.
Okay. You have anything to say on this, Emma? No?
No, I think Dr. Francois covered it sufficiently.
I think Dr. Joseph has a contribution to make on this as well.
Good morning. Good morning. I must say thank you for that valuable question as we pose, and thank you, Chair, for the opportunity to provide some clarity to the question. As it relates to the digital vaccination certificate to verify the vaccination status of an individual, a component of our COVID-19 response that is critical to our management of the whole pandemic in St. Lucia. We did collaborate with the Division of Public Sector Modernization in the design and development of a COVID-19 vaccination certificate. This, many of you would be aware of, that was launched on the 29th of December, and many persons would have applied. We have learned from the vaccination statistics that over 50,000 persons are eligible for this certificate. And just to note that we have over 1,300 persons who would have applied already, and some would have received their certificate. Now, this certificate is very important as it provides pertinent information as it relates to your vaccination status, whereby you can use it at a health facility to confirm your vaccination status, or at a non-health facility, including, we know, the restaurants and many other institutions do have protocols that require the confirmation of vaccination status. Also, it allows persons who have to travel cross borders to have a proof of vaccination that is very mobile, in the sense that they can store the information on a digital device, such as your phone or a tablet or your computer, so you can take it around with you. Also, you're able to print this product and integrate it in it. It's a very special feature, which is the QR code. So while you may want to look at the actual certificate with the pictures and your type of vaccines you would have received, there is that QR code inbuilt for the purpose of scanning to really prove if you are the holder of that digital vaccine certificate. So for persons who will be utilizing this at their facility to ensure that the person who is presenting is the true holder, do not just look at the picture or the information on the card when it is open, but also you have your personal device, such as a cell phone, that you can download the app, a QR reader, and once you scan within a few seconds, the information of that individual will come up. I know that we will provide you with further information as it relates to a date where we can provide even more information as it relates to the COVID-19 digital vaccine certificate. I must say that with regards to verification at locations so identified, we are working with other agencies. We know there is a challenge in terms of verification at the point of use, whereby persons would have to present, and there are some organizations, some business places who may be accepting persons without the proof of vaccination. But also, we do have inbuilt working from a multi-sectoral perspective with the police in the early rollout and designing of the protocols to have spot checks through the police and other agencies. We do know we have within the Ministry of Health, these agencies or personnel can present spontaneously at your facility to ensure that persons within the confines of whatever activity you are having are vaccinated. So we will provide you with further information. We are going to have another media appearance from a multi-sectoral perspective, as we recognize this is not only a health initiative, but we do have the Division of Public Sector Modernization, and we'll be able to provide you with more in-depth response. Thank you. Over to you, Chair.
All right, thank you, Dr. Joseph.
Thank you. Good day.
Thank you, and good day. Have a good day. Any other questions from the media pool?
Yes, please. I'd like to ask a question, if I can be heard.
Yes.
Am I being heard?
Yes, go ahead, please.
Sorry?
Go ahead.
My name is Natalie Dabrio from One Caribbean. I actually have two questions.
Fine.
First question is, please expound on the process of recording adverse reactions to the COVID-19 shots. How is it vetted, that process, and in what manner is this information made available to the public? That's the first question.
Yes, go ahead with your second, please.
The second question is, will the Ministry of Health consider establishing an immune boosting system or systems, package and supports, including provision of essentials and tax breaks on imports for those who would prefer not to take the COVID-19 shots, but would like to avoid getting an acute case of COVID at the very least? Thank you.
Thank you, Ms. Dabrio.
Okay, thank you for your question, Ms. Avrio. I will address the question on the reporting of ESAV's adverse events. There is an established process for the reporting of events that are supposedly attributed to vaccines and vaccination. So when someone receives a vaccine, it is likely, we know that it is likely that he or she may experience a side effect, and there may be likely adverse events. I know this is an area that persons have been requesting data on, and it has been said that we are not providing information regarding adverse events. This, our ESAV surveillance system, as I indicated earlier, the process is there. Obviously, it needs strengthening, but in order for us to be able to report any data to the public, we need persons. We are encouraging persons. Persons need to report. The process is such that if somebody experiences a side effect, they need to report that to the healthcare provider. This information, once received, our process is still a manual one. We have a form, a reporting form. This is completed by the person by the healthcare provider, whether it's the nurse, the physician, the pharmacist, whoever that you are reporting. This person has the responsibility to complete that form with all details, and this form is submitted to the immunization manager, or it could be submitted to the regional supervisor, who would, of course, forward this form to the immunization manager. Once it gets to the ministry level, the immunization, there's a core team that would review the forms, and of course, persons will be contacted. This data is passed on to our regional agency and for further investigation. I have to say that on the ground, and the feedback that we're getting is that everybody seems to know, or there's a lot of talk, for lack of a better term, about persons who have had adverse events, severe adverse events, etc. But where exactly are the reports? Very few reports have been made, most of which, when you relate to the persons who are the clients, they're really side effects and not severe adverse events. If there were any serious adverse events, most of these reports have not been submitted, and this is what we are encouraging persons to do, so that this, of course, we could provide you, the public. I mean, it is your business, it is our business, so you have a right to know. But if we don't have that data, we cannot provide you with it. As I would have indicated, we have had reports. We have had a few cases of allergic reactions, which is not uncommon. Persons react to the minor ingredients in the vaccine, the color component, etc. And we note these are recorded as allergic reactions. The majority, fevers, chills, body pains, etc. So we have, and I just want to take this opportunity also to indicate that we have not had any deaths in St. Lucia that is related to vaccines. And I will just go back to my point where we are encouraging persons. And this is the only way. I mean, though we understand that our process needs strengthening, we are working towards that. We're actually working towards a digital form of reporting where persons can report digitally. This is really what we're working on now. But there is a process, and we're encouraging persons to report any side effects that they would have.
Lucia, Batiste, very quickly, how many reports have you received since the pandemic?
If I were to refer to my favorite, less than 30.
Less than 30?
I have less than 30 forms in my possession.
Less than 30?
Yes.
And all of these are mild side effects?
Some are allergic reactions.
Yeah. You're going to say something, Dr. Clark?
Yeah, I just wanted to reiterate what Lucia Baptiste is saying, that there is a lot of talk on the ground about those adverse events, but nobody's really getting those reports. So I have also received, and I mean, I put out a call. You could call my office and let us know if you're having side effects, in addition to what the ministry said, or just call your nurse at the health center or anybody. I've received 2 since we started vaccinating. And again, allergic reactions. The others really have been the normal reactions that we've spoken about that you expect when you get not just this vaccine, but any vaccine. So that is important, that if indeed you think you have an adverse event because of a vaccine, you need to report it, because that really is the only way to know. In terms of the talk with conviction of deaths because of vaccines, as you said, there are no known deaths because of vaccines in St. Lucia. Any suspicious death, and this is not just because of COVID-19, any suspicious death, a postmortem examination is done. So if I have a 25-year-old who dies suddenly, a postmortem examination is done to try to figure out why this person would have died. or if somebody's in hospital and that person was perhaps getting better and they died, a post-mortem examination is done. So people don't just die and it's just left that way, because we have to write the death certificates, and there's a process to writing a death certificate, which simply doesn't allow you to put anything. So we don't have any of those reports, and we wouldn't know because we are the physicians on the ground. And I just want to make one note in terms of testing, because we always have to look at our population, and the ministry, of course, as Dr. Belma said, is going to have their policy with regard to testing. But when it comes to the home test, we have to know our population. I like to equate it to modalities of dialysis. I speak of dialysis a lot, of course, because I do kidney medicine. When you speak of something called peritoneal dialysis, not every patient can do peritoneal dialysis because they may not do it effectively.
What is peritoneal?
It's because you're doing it essentially yourself. So not everybody, it's not the dialysis where you come into hospital and a nurse is mostly doing it. So there are patients who will be able to do things that my, say, 85-year-old grandmother would not be able to do. And when we look at testing, sometimes those things also do have to be taken into consideration, because with home testing, let's just say somebody has to swab themselves, you have to think, would that person do it effectively? Would we be missing positive cases? We have to look at the false positives, false negatives, and a series of factors which could have very serious implications.
Thank you very much. Simo, you have anything to add to that?
I think the first question that was asked.
Oh, yes, about the immune boosting system support.
Yes, I just want to indicate that one very important component of managing COVID-19 is our immune system and staying healthy. So I'm going to take the opportunity to make it very clear that we advocate for healthy lifestyles. We see that the impact of COVID is worse on persons with conditions, health conditions, or persons who are not healthy. So the importance, we cannot underestimate the importance. It is extremely important that healthy eating, exercise, reduce stress, ensuring you get enough sleep, that we need to ensure that all of this is part of us keeping our immune system at an optimal level. It will reduce the impact and even reduce the number of people who get COVID. So for us, it is extremely important that we support and promote healthy lifestyles in reducing the impact, reducing the hospitalization of persons who develop COVID-19. So we absolutely support a higher healthy individuals and healthy populations. As to specific products getting tax breaks, I think there's a different process, not necessarily through the Ministry of Health to request this, but whatever healthy foods and vegetables that will promote health, the Ministry of Health would definitely support the use of those products in country, once there is evidence to show that these are healthy products for our people.
Right. So your point is that it's not just drugs; it's lifestyle.
Lifestyle.
Because if you have hypertension,
yes,
you have to stay off salt.
Yes,
right?
absolutely.
If you have diabetes, you stay off sugar. So the point is made. But it's something that we would look at in greater depth in the NCMC. So thank you for those questions. Any more questions from the media pool?
Thank you very much.
Thank you very much for these questions. Go ahead, please.
Yes, Mr. Springer, probably the final two from us when we come up with transfusion now. We will also consider and getting questions from members of the public as well concerning children, especially with this fifth wave. Have we seen any increase in the number of children being infected? Also, we have noted, outbreaks within schools across the region, namely Grenada and St. as well as Guyana, who started off school from the first week of January. So we just want to know what is in place if there is an outbreak at any one of the schools, and also what are some of the policies and guidelines as it relates to sanitization and deep cleaning of our schools. Thank you very much.
Thank you. Simo, Dr. Mayor.
Do you want to speak? I can take the first part. I'll take the first part. So thank you very much for your question. Obviously, we are quite concerned about our students, our children returning to school, given the numbers of cases active cases that we do have in country. We have been following very, very carefully the numbers. Even through the outbreaks, our numbers have remained constant for school-aged children. We are quite happy that it has ranged between the 11 to 12%, which is what is acceptable internationally. As the fifth wave have started, we made special note of it. The percentage is actually about 9 point something percent of school-age children, but it is something that, like I say, we continue to monitor. We have not seen an increase. We have managed the cases throughout the school year. We have had cases in schools, we've had teachers, we have had children. The majority of times these children would have acquired it from the household with a positive relative in the household and had come into school. There is a process that we go through with the Ministry of Education. There is a clearly defined process whereby the tracer would contact the district education officer, the principal. We get this class seating arrangement, and we identify persons who are the children who are most at risk. We decide on a testing day, have them tested, of course with the approval of parents, and informing the parents as well. And so all this correspondence would go to the parents as well from the ministry. And we manage together jointly the situation at the schools. So this is a process that we have highlighted. We have frequent meetings with the Ministry of Education, sensitizing prior to the opening of school what should be done, how to manage cases. The correspondence has been sent out to them. So we are all on the same page in terms of managing. Dr. Maya has stressed the importance of keeping our children in school. They have lost quite a bit in the last 2 years due to COVID-19. And so we at the ministry pay particular attention to the children and to schools, because it is something that we realize that we need to keep on track, and we cannot afford an outbreak within the schools.
Dr. Francois, can I ask you, and you mentioned 11%, which is the norm, but what would be the ceiling, what would be the threshold that would trigger a reconsideration of in-person schooling?
Well, we are looking at more, not the threshold per se, but we're looking at the schools and the level of outbreaks within the schools. Okay. So as we managed, we did not have any major outbreaks in any of the schools. We did not have to shut down any single schools. In very, very few occasions, we had to send entire classes home. And the times that was done was when persons were unable to give us their contacts. So we're looking at the schools themselves. If we notice, for example, within a region, we have to shut down 5 schools, then we have to reevaluate what is being done and possibly make that hard decision. But we are looking at outbreaks within schools. If we are able to have, as the numbers go up, we expect the children to get infected. We expect families, entire families, to come down with COVID-19. The Omicron is a lot more transmissible. But when we start noticing that schools have to be shut down, then that is time to reconsider what is being done and possibly pull back on schooling.
Right, thank you very much. We have just been told that we have just about 2 minutes left, so unfortunately we're going to have to wrap up at this point. I'm very sensitive to the fact that our person of the year has to return to her practice, and she has been out for an hour already. So it is our hope that this press conference has answered some of your questions. We encourage you, those of you who are not able to get your questions into us, to post these questions on the GIS's Facebook website, and we will make a very strong effort to respond to you within 24 hours. That is a promise that we give to you. We hope to do these press conferences far more often than we have done over the past 3 months, but as you would understand, this COVID fight has so many moving parts and so many people, so few people to address the many issues. When you have to make a choice between coming to a press conference or dealing with an urgent situation on the ground, it's an easy choice to make. But we do accept that we have to interact with you far more often. CMO and myself and Dr. Clark and others will continue to be accessible to you in the media. We ask just one favor of you, that you report accurately the interventions that we give to you. If you're unsure about something, come back to us. We will try to respond to you as quickly as we can. So, in summary, I think the presentations that you've heard today point us in one particular direction, that the effort we need to make is to live, work, learn, recreate with COVID. The options for not doing that are staying at home, loss of wages, loss of productivity, greater indebtedness, our inability to pay our loans, the disruption of the dreams of our children. Our children have their dreams, they have their goals. If you're in primary school, your goal is to get to secondary school. If you're secondary school, your goal is to get to university. And each of us has in our household one child who has that dream or has a combination of dreams. And as adults, those of us who have already made our way through life, even if we haven't, when you have a child, your preoccupation is 100% about the safety of that child and the growth of that child, the normal growth of that child. And so this is the sacrifice that all parents are required to make for the children. And it is one that we encourage you to remember as you conduct yourselves in your daily business, when you go out to the supermarket and so on. Remember there's a child at home who is depending on you being as disciplined as you can, as you must be, to ensure that he or she can fulfill their dreams. So I want to thank all of our panelists. As you note that they're all of a certain gender. And I was very happy that Dr. Joseph was able to intervene and save me some blushes being in the presence of. But I want to thank you all. I thank you for your hard work. It's a super effort that you're putting into this, and I want to ask the public to join us in making our country safe as we try to live with COVID. Thank you very much. Thanks to our friends at GIS and NTN, and have a good day.